Hello everyone, now let us discuss about anatomy of musculoskeletal system of hand. Now coming to bones of hand, you can categorize the bones of hand into three categories: carpals, metacarpals and phalanges. Carpals, which is nothing but the wrist, it is composed of 8 carpal bones, whereas metacarpals, which is nothing but palm, it is composed of 5 metacarpals, 5 metacarpal bones. Whereas phalanges, which refer to digits, digits are composed of 14 phalanges. So in total, hand is composed of 8 carpals, 5 metacarpals and 14 phalanges. Now coming to carpals. The carpus or wrist is the proximal region of the hand and it consists of 8 small bones, the carpals, joined by one another by ligaments. And the articulations among the carpal bones are called as intercarpal joints. Intercarpal joints are nothing but the articulations among carpal bones. And the carpals are arranged in 2 transverse rows of 4 bones each. This is important point. Carpals are arranged in 2 transverse rows of 4 bones each. And the names of the carpals reflect their shapes. Now coming to the carpals in the proximal row, from lateral to medial side, they are scaphoid, lunate, triquestrum and pisiform. We know that wrist joint is formed by the union of radius with these 3 bones, scaphoid, lunate and triquestrum. The shape of scaphoid is boat-like, whereas lunate, as the name indicates, it is moon-shaped. Triquestrum is 3-cornered, hence the name tri. And pisiform, it is spear-shaped. So the 4 carpals in the proximal row from lateral to medial are scaphoid, lunate, triquestrum, pisiform. The proximal row of the carpals, it articulates with the distal ends of ulna and radius to form the wrist joint, as we have discussed earlier. And the carpals in the distal row. Previously we have discussed the carpals in the proximal row. Now the carpals in the distal row from lateral to medial are trapezium, trapezoid, captate and hamate. These are the 4 carpals in the distal row. Trapezium means it is trapezium shaped, which is nothing but 4-sided figure with no 2 sides parallel. Next is trapezoid. It is also 4-sided figure with 2 sides parallel. Next is capitate, head shaped. Hamate is hook or hook shaped. So these are the 4 carpals in the distal row. In total there are 8 carpals and they are arranged in 2 transverse rows. Now coming to some more points regarding the carpates. The captate that we have discussed earlier is the largest carpal bone and its rounded projection, the head, articulates with lunate. And hamate is named for its large hook-shaped projection on its anterior surface. One more important point is, in about 70% of the carpal fractures, only the scaphoid bone is broken. So what is the most commonly broken bone in the carpal fractures is scaphoid bone. This is because the force of a fall on an outstretched hand is transmitted from the captate through the scaphoid to the radius. For that reason, in 70% of the carpal fractures, only the scaphoid is broken. And let us discuss about carpal tunnel. The anterior concave space formed by the pisiform and hamate on the ulnar side and the scaphoid and trapezium on the radial side with the roof-like covering of the flexor retinaculum, which is nothing but the strong fibrous bands of connective tissue, is the carpal tunnel. So all these things, they form the carpal tunnel. That is concave space formed by pisiform and hamate on the ulnar side and scaphoid and trapezium on the radial side along with flexor retinaculum. They form a carpal tunnel. The long flexor tendons of the digits and thumb and the medial nerve and the median nerve pass through the carpal tunnel. And the narrowing of the carpal tunnel due to such factors as inflammation may give rise to a condition called as carpal tunnel syndrome. This is a common condition. Now let us discuss about metacarpals. The metacarpus is the intermediate region of the hand and it consists of 5 bones. The metacarpus is the intermediate region of the hand and is composed of 5 bones which are metacarpals. Each metacarpal bone consists of proximal base, intermediate shaft and a distal head. Proximal base, intermediate shaft and a distal head. And the metacarpal bones are numbered 1 to 5, Roman numbers 1 to 5, starting with the thumb from lateral to median. And the base articulates with the distal row of carpal bones to form the carpo-metacarpal joint. The proximal base articulates with the distal row of carpals. Proximal base of metacarpals articulates with the distal row of carpal bones to form carpo-metacarpal joints. Whereas the head articulates with the proximal phalanges to form metacarpophalangeal joints. And the heads of the metacarpals, commonly called as knuckles, are easily visible on a clenched fist. Knuckles are nothing but the heads of the metacarpals. Now coming to phalanges. Phalanges or bones of digits make up the distal part of the hand. And there are 14 phalanges in the 5 digits of each hand. Like the metacarpals, the digits are numbered 1 to 5, beginning with the thumb from lateral to medial. And a single bone of a digit is referred to as phalanx. Single bone of a digit is referred to as phalanx. Each phalanx consists of proximal base, intermediate shaft and distal head. Exception is thumb. The thumb has 2 phalanges and there are 3 phalanges in each of the 4 digits. Thumb only has 2 phalanges or 2 bones are there in thumb. Whereas all other 4 fingers, they have 3 phalanges each. So in total there are 14 phalanges. In order for the thumb, these other 4 digits are commonly referred to as, in the order from the thumb, these other 4 digits are commonly referred to as index finger, middle finger, ring finger and little finger. The first row of phalanges, the proximal row, articulates with the metacarpal bones and second row of phalanges. The second row of phalanges, the middle row, articulates with the proximal row and the third row called the distal row. The thumb has no middle phalanx and the joints of phalanges are called as interphalangeal joints. You will understand this better when you see the figure. The first row of the phalanges, the proximal row. First row is nothing but the proximal row. It articulates with the metacarpal bones and second row of phalanges. And the second row of phalanges, which is nothing but the middle row, it articulates with the proximal row and the third row called the distal row. Thumb has no middle phalanx. That is important point. Joint, because thumb has only 2 phalanges, whereas rest of the 4 fingers, they have 3 phalanges each. So they all have middle phalanx. Whereas thumb does not have a middle phalanx. And the joint between the phalanges are called as interphalangeal joints. Here you can see the figure of hand. If you see here, the carpals, they are arranged in 2 transverse rows, 4 bones in each row. So there are 8 carpals. This is radius and this is ulna. And these are the carpals. These 5. 1, 2, 3, 4, 5. Starting from thumb. These are metacarpals. And here, these are the phalanges. Thumb has only two phalanges, 1, 2, whereas other three fingers, they have 3. 1, 2, 3. 3 phalanges. 1, 2, 3. This is the base, this is the shaft, and this is the head of a phalanx. A single phalanx has base, shaft, and head. Similarly, a single metacarpal also has a proximal base, shaft, and head. So when it comes to phalanges, this is the proximal phalanx, this is the middle phalanx, and this is the distal phalanx. Whereas thumb does not have the middle phalanx. It has only proximal and distal phalanx. Rest of the 3 fingers, they have proximal, middle, and distal phalanx each. Rest of the 4 fingers, they have 3 phalanges. Thumb only has 2 phalanges. Now coming to the muscles of hand. Previously we have discussed the bones. Now we'll discuss about the muscles. Before discussing about the muscles, let us discuss the terminology regarding certain roots which are used in the names of the muscles so that we'll have a better understanding. First we'll discuss about abductor. Abductor means moves a part away from the midline. AB means moves away. And pollicis. Pollicis is nothing but thumb. Thumb is also called as pollicis. Brevis is nothing but short. Opponens is nothing but opposes. Flexa means decreases angle at a joint. Adductor. Adductor means moves part towards midline. ADD means move together or move towards the midline. Digit. Digit can be either toe or finger. Minimi means the smallest. Lumbric means earthworm, the shape of an earthworm. Ossi means bone. Dorsal means back surface. These are some of the terminologies. Now coming to the muscles of hand. The extrinsic muscles of hand, they produce powerful but crude movements of digits. Whereas the intrinsic muscles of hand in the palm, they produce weak but intricate and precise movements of the digits that characterize the human hand. So here we will be discussing about the intrinsic muscles of hand. And they are so called as intrinsic muscles because their origin and insertions are within the hand itself. And intrinsic muscles of hand, they are divided into 3 types: thenar, hypothenar, and intermediate. Coming to the thenar muscles, which form the lateral aspect of the palm. The first muscle in it is abductor pollicis brevis. Origin of this abductor pollicis brevis is flexor retinaculum, scaphoid, and trapezium. And insertion is lateral side of the proximal phalanx of thumb. As the name pollicis means thumb, so this muscle, it is related to thumb. And abductor means it moves the part away from the midline. Brevis means it is short. Abductor pollicis brevis. So the insertion is lateral side of the proximal phalanx of thumb. Action is it abducts the thumb at carpo-metacarpal joint. The action of abductor pollicis brevis is it abducts the thumb at carpo-metacarpal joint. And it is innervated by nervous innervation is median nerve. Next is opponens pollicis. This is also related to thumb. Opponens means opposes. So the origin of opponens pollicis is flexor retinaculum and trapezium. Insertion is lateral side of first metacarpal of thumb. Action is it moves the thumb across the palm to meet any finger opposition at metacarpal joint. As the name indicates, it moves thumb across the palm to meet any finger in an opposite direction at metacarpal joint. And innervation is median nerve for opens pollicis also. Next is flexor pollicis brevis. Flexor means it performs flexion. Flexion means reduction in the angle between joint. So the origin of flexor pollicis brevis is flexor retinaculum, trapezium, captate and trapezoid. And it is insertion. Coming to the insertion, the lateral side of proximal phalanx of thumb. Action is it flexes the thumb at carpometacarpal joint and the metacarpophalangeal joints. Coming to the innervation, it is innervated by median and ulnar nerves. The next is adductor pollicis. So pollicis, all these are the muscles of thumb as the name indicates. So we need to focus on the root word for better understanding. Adductor. Adductor means moves towards the midline. Coming to the origin of adductor pollicis, it is the oblique head originates from the captate and second and third metacarpals, whereas the transverse head originates from third metacarpal. Coming to the insertion, it is inserted on the medial side of proximal phalanx of thumb by tendon containing sesamoid bone. Coming to the action, it adducts the thumb at carpometacarpal joint and metacarpophalangeal joints. Innervation is ulnar nerve. Now coming to the next subcategory, hypothenar, which deals with the medial aspect of palm. Hypothenar is, there are three types of hypothenar muscles: abductor digiti minimi, flexor digiti minimi brevis, opponens digiti minimi. So digiti means related to digits. Abductor means it abducts. Minimi means it's the smallest. So coming to first muscle, abductor digiti minimi. Origin is pisiform and tendon of flexor carpi ulnaris. Insertion is the median side of proximal phalanx of little finger. Smallest. Minimi means it deals with the little finger. All these things, all these three muscles, it deals with little finger. Minimi, for better understanding. So median side of proximal phalanx of little finger. Action is it abducts and flexes the little finger at metacarpophalangeal joint. Innervation is ulnar nerve. Next is flexor digitalis digiti minimi brevis. As the name indicates, it flexes. First, let us discuss about the origin. Origin point is flexor retinaculum and hamate. Insertion is the median side of proximal phalanx of little finger. Next action is it flexes the little finger at carpometacarpal and metacarpophalangeal joints. Innervation is ulnar nerve. The next is opponens digiti minimi. Median origin point is flexor retinaculum and hamate, whereas the insertion is the median side of fifth metacarpal of little finger. It moves little finger across the palm to meet thumb opposition at carpometacarpal joint, as the name indicates. Opponens means opposes. It is also innervated by ulnar nerve. So all the hypothenar muscles are innervated by ulnar nerve and they are responsible for the movements of little finger. Now coming to the final thing, intermediate, which is nothing but mid-palmar. It is composed of three muscles mainly. Lumbricals, there are 4 in total, and palmar interossi, 3 muscles. Dorsal interossi, 4 muscles. Ossi means bone, lumbricals means it is earthworm-like. Coming to the origin of lumbricals, which are 4 in number, is the lateral side of tendons and flexor digitorum profundus of each finger. Coming to the insertion, the lateral sides of tendons and extensor digitorum on proximal phalanges of each finger. The action of lumbricals is they flex each finger at metacarpophalangeal joints and extend each finger at interphalangeal joints. Innervation is by median and ulnar nerve. Coming to palmar interossi, it is 3 muscles in total. Origin is sides of shaft of metacarpal of all digits except the middle one. And insertion is sides of bases of proximal phalanges of all digits except the middle one. Action is it adducts and flexes each finger except the middle finger at metacarpophalangeal joints and extends these fingers at interphalangeal joints. Innervation is by ulnar nerve. The next is dorsal interossi. It is composed of 4 muscles. Adjacent side of metacarpals. Origin is adjacent sides of metacarpals. Insertion is proximal phalanx of each finger. Next, the action is it abducts 2 to 4 at metacarpophalangeal joints, flexes fingers 2 to 4 at intercarpometaphalangeal joints, and extends each finger at interphalangeal joint. Innervation is by ulnar nerve. Now here you can see the diagrammatic representation. This is the abductor digitali minimi. So this governs the little finger. Whereas this one is the flexor digitali minimi. And this one is the third one, opponens digitali minimi. This is the medial aspect. Now coming to the lateral aspect, opponens pollis, this one, small, this thing is opponens pollis. Next, this big one is abductor pollis brevis, and here below it is the flexor pollis brevis, and this one is the adductor pollis. These all deal with movements regarding the thumb. Now, regarding the midcarpal things, there are 4 lumbricals. You can see here 4. 1, 2, 3, 4. 4 lumbricals. And regarding the midcarpal, mid-palmar muscles, we have another picture. So as of now, you just see the muscles of little finger and the thumb in this particular figure. Now, here you can see, previously we have seen the 4 lumbricals. Now we'll see the palmar interossi. These are the 4 palmar interossi. 1, 2, 3, 4. And these are the 4 dorsal interossi. Thank you for watching. Please subscribe for further videos on anatomy and physiology.